Hi, I'm John. I'm a physiotherapist with Pure Physio in Albany in New Zealand. I'm going to talk to you today about the knee and more importantly about the patellofemoral joint. Now this is a joint which is formed from the femur, the thigh bone, the kneecap or patella, and it's really just a posh pulley system which makes a hinge joint move. Now this is a really important joint for going upstairs, standing up from a chair and various other activities including walking and running. Now what it does is basically the quads muscles, which are the largest group of muscles in the body, attach to the top of the kneecap, and as they pull, they transmit the force through the kneecap onto the shin bone, the tibia, and that enables the leg to become straight. So, as you can imagine, this is really important, lifting body weight out of a chair, pushing you up against gravity, going upstairs. Now, what can happen is whenever this contraction happens, the quads muscles attach to the outside of the pelvis, so they're angled out to the side. Now, this can make the kneecap slide out to the side and cause pressure behind the kneecap and therefore pain. This can happen in a number of people. Typically, it can happen in females as they grow, so teenage females particularly. As their pelvis gets wider, the quads muscles that angle gets further, and that causes more pressure, more pain. Equally, what normally happens is that there's a muscle on the inside which pulls in, moves the kneecap across, and that evens out the pressure, a muscle called VMO. So what happens is that either the knee swells or that muscle can be pain inhibited. And when that happens, that muscle gets less active, and as it gets less active, the pressure increases. So as a patient gets out of the chair, as someone sits for a while, the kneecap drifts out to the side and either twists in and causes pain on the inside of the knee, or compresses on the outside, causes pain on the outside of the knee. Now, with this problem, there are a number of things we can do to strengthen that muscle on the inside, to alleviate the pressure behind the kneecap, and therefore alleviate symptoms. That said, we need to also find out what caused the problem. Is it just a growth problem, or is there an underlying problem which has caused the knee to become painful, caused the knee to swell, and that needs to be addressed first? So, whichever way we're looking, it's a great idea to either click on our link and book online to come and see us if you're suffering from this kind of problem, or give us a ring and have a chat and see what we can do to help. So, as I say, I'm John from Pure Physio in Albany, New Zealand. Come and talk to us if you're having any of these kind of symptoms.